Hi, I'm Dr. Wayne Collins from South Lake Medical Center in Pasadena, California. Today we're going to talk about our very unique program for frozen shoulder. Now, we see frozen shoulders from all over the state, all over the western United States, even out of state, and we do very, very well with them. And the reason for that is that we've developed this very, very unique protocol. Now, a frozen shoulder is defined as a shoulder where the shoulder joint itself doesn't move. It'll lock like that, it'll lock here, can't go over their head, that kind of thing. It's very, very painful, causes all kinds of problems. People can't sleep from it. It's just awful. And over a period of time, if it's not corrected, it'll get worse. Now, part of the reason that frozen shoulder treatment is not successful is, in my view, it's done incorrectly. Most of the time, a frozen shoulder problem is not an orthopedically frozen shoulder, rather it's a neurologically based frozen shoulder. Now, let me talk to you about that and let me explain to you a little bit about that. Now, here would be a muscle, okay? In the center of the muscle there's a cell called a spindle cell that controls the tone of the muscle. At the polar ends of each muscle, right where the ligaments attach to the tendons attached to the bone, there's what we call the Golgi tendon apparatus, and that sets the tone or length of the muscle. What we're finding is in people who have frozen shoulders, this mechanism has gotten screwed up and it doesn't work correctly, so therefore your brain and your cerebellum in particular in your brain cannot coordinate normal body movements, and therefore the muscle becomes frozen. Or the joint becomes frozen. Let me talk to you a little bit about exactly how this works. Okay? Now, if you decide you want to make a movement, this is what happens. Okay? As we look at your brain right here, there is a pathway right here. It's called area 4 in your cortex of your brain. That's what we call the primary motor output pathway. So let's say you decide you want to move your arm, okay? You stimulate a nerve root. The nerve root comes down, goes down through a tract in your spinal cord. We go like this. Here's your spinal cord. It's called the cortical spinal tract right here. Over there, once it gets to that point, it communicates in your ventral horn cell of your spine to a motor output nuclei. It's right here. Now, in order to move a joint, it's a disynaptic pathway, meaning that there's two nerve endings that fire off in order to move a joint. If I'm going to take my elbow as an example and flex it, there has to be a nerve ending that's going to tell my bicep to contract and my bicep to relax. Now, this is the mechanism that gets kind of screwed up and it limits motion. They don't fire off normally because of trauma and whatever. So therefore, the nerve root that either goes to the bicep muscle to make it contract, or the nerve ending that goes to the tricep muscle, as an example, to make it relax, either one of them doesn't work. The end result is you get this abnormal motion. So what we've been able to do is we've been able to design a treatment protocol that works extremely well to correct this. So let me show you some of the other treatments that are going to be involved. Okay, one of the treatments we're going to do and use is a brand new type of treatment that's called pulsed electromagnetic field therapy. We use a mega-pulsed electromagnetic field therapy unit. It's the only unit like it on the West Coast. We have people, like I say, coming to us from out of state. So what this device does, if you can pan over here, what this device does is it puts out a pulse electromagnetic field pulse through these two pads, and the pulsation normalizes the electrical energy of the tissues that are in there, and it makes the tissue heal. So that over a period of time, as we normalize function, we're also stimulating the nervous system to function properly and to heal itself. So that's just one of the things that we do. Let's go take a look at another. One of the other things we're going to use in our shoulder procedures is the use of our high-powered super class 4 mega class 4 therapy laser. This puts out a beam of photonic energy, and you can see it right here. You can see the red light right here. Right here you see the red light from the laser beam itself. And what this does is it goes into the tissues anywhere from 6 to 9 inches. It'll pass right through the tissue, and it helps to stimulate circulation, all that kind of stuff, stimulate mitochondria in the cells so the tissue itself will regenerate itself. So besides doing the direct treatment on the tissue, we're also going to regenerate itself and all the chronic stuff so it starts to work more normally and regenerate the nerves a little bit, so it'll help maintain its correction once we get you there. So the bottom line is, you can see this thing's quite powerful, and I don't have it on right now. This is just the aiming beam, because I couldn't hold my hand here and do this. It gets too high, so I would have to keep moving it and stuff like that. So the bottom line is, it works very, very well. Now let's go talk about some other things. So anyway, in conclusion, we have a very, very innovative and one-of-a-kind protocol for shoulder pain. Only one of its kind on the West Coast. We use what we call functional neurology rehab therapy, which is the technique that's going to, we've developed, which is going to normalize the neurology here. We use the megapulsed electromagnetic field therapy, the only ones of its kind on the West Coast, and our mega class 4 laser therapy that I just showed you. Both of those, all of those things, I should say, work to normalize the tissue function and work on the tissue where it's been irritated and sore, and we get absolutely excellent results. Bottom line is, usually I can get all of your range of motion back the first day, and the bottom line is, if we don't get it back within a day or two, I'll refund your money. Bottom line. This works extremely well. Who else is going to make you that guarantee? I will, because it works that well. So thank you so much for watching, and please watch the other videos we have on the website here on frozen shoulder. I think you're going to like them. The results are pretty amazing. They speak for themselves. Have a great day, and thanks so much for watching.